Someone ever told you that all your pain is just in your head?
Well, that's not nice. That's not a nice thing to say.
It's not nice, but some of it may be true.
Whoa, what are you talking about?
Well,
You're going to upset a lot of people here.
Stick around. Welcome to Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Salazar.
So there's growing research, I'd say, in all sorts of areas of medicine that different parts of our body are connected.
Okay.
Right? So like our mind and our gut, we realize that's connected. But there's growing evidence to show that our mind, like our brains, as well as the pain that we experience, are connected as well.
And this is something, we heard when we were training, and I think you might have heard as a patient more recently, where a doctor or a healthcare provider might tell you, oh, all your pain is in your head. It's in your head. There's nothing wrong with your knee. There's nothing wrong with your hip. There's nothing wrong with your leg or your back. The pain is in your head. And our professors, our teachers used to say that, it's in her head. It's in his head. There's nothing wrong there. That is not a very nice thing to say to people, and it's just not true the way you're saying it.
Right. And what would be a better way to frame it is we don't have any objective evidence that identifies something that would explain the severity of your pain, and some of it may be a contribution of a whole bunch of factors that are present in your brain, not necessarily in your knee.
Your mental health. Your mental health may be affecting how you perceive pain, or even if you perceive pain, okay? So that's what I think people were trying to say 30 years ago or 20 years ago, but they didn't know it.
And I think for me, the whole thing kind of makes sense, right? So if you're sad already, and then you sprain your ankle, I think that hurts more than if you sprain your ankle and you're running a race, you're playing football with your friends, or you're running to catch the ice cream truck like Eddie Murphy was.
Yeah. Now listen, if you've been Eddie Murphy,
remember from Delirious? Ice cream!
Oh, yeah.
The ice cream man is coming!
The ice cream man is coming! The ice cream man is coming!
So if you've been told that and it really upset you, leave a comment. Let us know if someone said, oh, it's in your head, when you know there's something going on that's making you feel this pain. You're right, okay? And we're going to explain why and how your mental health actually creates the pain, or amplifies the pain, or makes you feel the pain, or makes it hard for you to get rid of the pain, okay?
Right. So are there specific conditions that specifically contribute to people that experience more pain or more severe pain, or pain for longer periods of time?
Yeah, let's go through it. So if you think of chronic pain, if you're someone who's in chronic pain, it turns out that anxiety and depression is closely associated with chronic pain, okay? So it's to the tune of about, people who have chronic pain, there's a 40% chance they also have anxiety and depression.
Whoa.
That's a big association.
Yeah.
And there's a lot of research that's been going on recently into this that's showing, this is a thing. These are linked.
And I think there's another thing that said people with anxiety and depression have a 2 to 3 times increased chance of having chronic pain or more severe pain.
Right.
Yeah.
So causative, well, you might say, I'm in chronic pain. That's why I have anxiety and depression.
Yeah.
Maybe.
Fair.
But there's definitely an association there.
Yes.
Okay, what about anything that could have happened in your life before?
Well, I'd say more and more we're learning that negative child experiences or trauma or adverse childhood events.
Adverse childhood events, ACEs.
ACEs is the thing they call this, definitely negatively affect all sorts of our health, not just our mental health, but also our physical health.
Absolutely. So there's been some studies looking into this, and they've looked at people who've had these adverse child events, and the number of adverse child events that you have experienced directly correlates with your chance of developing chronic pain later in life. Right. Physical pain that you feel from these adverse events. Do you remember the numbers?
4. So I think 4 was kind of that kind of break.
If you've had 4 adverse child events,
it
doubles your chance of having chronic pain later in life.
And I think this is always tricky too, and tricky that you discuss it with a therapist, and you can't change the fact that you've had adverse childhood events.
No.
But I think it's important to recognize that you had them and maybe address them with a therapist or a counselor or whoever to help understand why you're maybe feeling this way, and then arming yourself with tools to get through that kind of stuff.
Right, exactly. And so it's like trying to deal with your heart disease. Oh, you've got heart disease. I'm going to try to do the heart disease. I'm going to do the heart disease, and you've got underlying diabetes that you're leaving untreated. You can treat you can treat the heart disease as much as you want, but until you treat the diabetes, the heart disease is going to continue to get worse.
Yep.
So you've got to treat the underlying cause. Now we've identified, not we, you and I, that's for sure, but smarter people than us have identified sort of like mental health things that can explain why this happens. And there are a few. There's one called pain catastrophization. Okay. Thinking, oh, this is the worst pain ever. This is worse. I can't believe this is happening. This is the worst pain I've ever felt. That's kind of catastrophizing the pain.
Okay, that's number one. Number two is fear, like avoidance. You're like, oh man, I have so much pain. I'm not going to do anything. So it sends you into a cycle of inactivity and avoiding doing things, which makes your pain worse.
Right. They call it kinesiophobia. You're afraid to move because you have the pain, so you think you're doing harm.
Right.
Whereas really you're helping yourself by moving, and the muscles get weak, and that gets worse and worse. And then the next one is low self-efficacy, thinking, oh, nothing I can do is going to make this work. It's going to help.
Right. And then the last one is just kind of being a bit of a Debbie Downer and having poor recovery expectations, saying, you know what, I don't think I'm going to get better.
That's it. So those sort of 4 thought processes can lead to this pain happening or getting worse or never getting better. Okay, so we've said, okay, well, there's an association. We said there's an association between depression, anxiety, and pain, and adverse child events, and pain. Is there something, what's that?
There's other things that play a role.
Yeah, let's go.
Chronic stress, and poor quality sleep,
Well,
which we talk about, pillars of health.
All the time.
You need restorative sleep.
Oh boy, with the restorative. Just good sleep will do it.
Anyone that watched our 9 Foods for Dementia will know that I say restorative sleep a lot. It's
I've
like I got like a shirt that says restorative sleep guy.
Restorative sleep.
Yeah, so you need restorative sleep and reduce our stress. And these are hard things to do. Hard to get a good sleep, hard to not be stressed.
Yeah, and when you're in this state, you're sensitized to pain. You're sort of amplifying, you're amped up, and your central nervous system is just ready to feel more pain when you're in these states.
Right.
Now the question is there anything we can do about this? Like basically, should we be changing our examining room tables in our exam room and changing them for couches?
So I think that could be part of it. As surgeons, I think we probably don't have the expertise necessarily to counsel people, but I think acknowledging, is worth something. So telling people, listen, maybe your x-ray doesn't look as bad as your pain appears.
Right.
And there's a bunch of things that could be part of that. And not to say, hey, it's your depression that's causing your knee pain, but acknowledging it, kind of recognizing it, and then recommending strategies to say, hey, maybe go back to your family doctor.
Absolutely.
If this is something that you battle with, try to reduce your stress. Try to improve your quality of sleep. But I think acknowledging, is probably the biggest thing.
Okay,
validating.
So is there any evidence that this actually works? Yes, there is a growing body of evidence that says, look, if we treat someone's pain with physiotherapy or physical therapy, or we treat it with physical therapy and cognitive behavioral therapy, it's much more beneficial to do both. Cognitive behavioral therapy helps treat the chronic pain, and that's telling people how to deal with their thoughts. Those thoughts we mentioned, how to manage those thoughts can help you get rid of your pain.
And I think it's a combination of recognizing the intrusive thoughts or negative thoughts that you have, kind of being present in the moment, accepting them for what they are, recognizing the feelings that they cause you, and then trying to address them and frame them, and reframe them really.
And then there's even a newer sort of behavioral therapy that's emerging. It is called emotional awareness, what's it called?
Expression therapy.
Emotional awareness expression therapy.
Eat.
Eat.
Yeah.
Emotional awareness expression therapy.
Okay,
and that is, cognitive behavioral therapy teaches you to deal with your thoughts. Emotional awareness therapy tells you how to deal with your emotions. If you have some unchecked emotions because of something that happened to you previously in life, and you leave those unchecked, it's thought that sort of keeps that sympathetic system open and ready to experience pain. So trying to understand how you can deal with those emotions in a healthy way can actually help your physical pain. Fascinating, isn't it?
It is.
Why does a couple of orthopedic surgeons care about this? We care about this because we're in the business of treating pain.
Right.
But we've been trained just to look at it at an x-ray, a physical examination of the body part, and come up with a diagnosis. We and most orthopedic surgeons around are not trained to understand the other factors.
I would say all, but yeah, most for sure.
And that's where the term, oh, it's all in your head. That's why we used to say that, because we didn't understand it. I'm not saying we, I've never said that to a patient in my life, but I've heard of other people saying that to their patients.
Right.
And this is legit. I do have a case where I had this woman replaced her knee, and she was still having pain, still having pain, still having pain. And she seemed sad, seemed really down.
Yep.
And at one point I just said, you seem really sad. Have you talked to your doctor to see if you've ever been diagnosed with depression? She said no. Then she did go talk to her family physician. She did get diagnosed with depression. She did get treatment for her depression. And lo and behold, her knee pain got better.
Nice.
her post-op knee pain after knee replacement got better.
It's awesome. And it makes sense, right? You know, they talk about like laughter is the best medicine, staying positive helps you get through disease. It makes sense that if you're in a negative space, that affects us on a physiological level that's measurable and can make us unhealthy and make us feel more pain.
There you go.
Now you know. If you like this video, please like it, subscribe to our channel, share it with someone that you know is maybe struggling with some of these things and has a lot of chronic pain, and maybe kind of nudge them along to say, maybe you need to talk to somebody.
Hey, and if this has happened to you, if you can validate anything we just said from personal experience that you've had, please put it in the comments so we don't look like we're nuts talking about this stuff.
There you go.
Remember, you are in charge of your own health.
See you next time.